If you're having pain on the inside of your knee from an injury or a twisting motion, you may be dealing with an MCL sprain, also known as a medial collateral ligament sprain. Hi, I am Dr. Sebastian.
And I'm Floyd. I'm the PA working here at Integrative Rehab Medicine.
Today we're going to talk about the MCL sprains or medial collateral ligament sprains. We're going to talk about what they are, what are the symptoms, how to best diagnose it, and how to treat it. So what is an MCL sprain?
So this is a model of the knee that we have here. So your MCL, also called the medial collateral ligament, it's going to be the main stabilizing ligament on the inside part of your knee. It's going to connect the two bones together. And so when you have an injury here, it's going to cause instability of the knee joint itself.
So the symptoms of an MCL sprain are typically pain on the inside of the knee, pain with climbing or movement, a feeling of instability, clicking and locking, and really feeling like the knee is going to give out. MCL sprains are common, but luckily we can diagnose them easily and we can treat them. So how do we diagnose an MCL sprain?
So most important is going to be a physical exam. You can actually push on that area. A lot of times it's going to be just tender focally to it. You can also stress the joint itself and see if that reproduces the pain, and also see how much laxity is present. When people have larger tears, you can actually move the joint a lot more, and then we can put an ultrasound on it so we can look for the tear itself, but we can also look for swelling or inflammation in that tendon. And then an MRI is going to be the most definitive way of looking for it. And the MRI is going to help show the MCL tear, but it also can potentially show some of the other structures that may be damaged. A lot of times you have the terrible triad, which is MCL, ACL, and the meniscus. They can all get damaged at the same time, especially with a sporting type injury.
So it is very important when diagnosing an MCL sprain to really examine the whole knee, because just like Floyd said, very often other structures are injured, and that creates instability of the knee, weakness, and then potentially these are targets that we need to treat. The standard of care treatment is taking anti-inflammatory medications, which we don't really recommend because they have side effects and they don't really do anything for healing. Some patients get steroids into the joint or around the ligament, which again is typically not a very good idea because steroids, even though they decrease inflammation, they can actually weaken the ligaments and weaken the cartilage of the joint. What we really prefer in our clinic is regenerative medicine, which can really provide true healing and a return to function of the knee. So the regenerative medicine treatments that we use are prolotherapy, PRP, and stem cells. Can we talk about what these modalities are?
So prolotherapy are going to be injections with dextrose, so it's a type of sugar water, and what it does is it causes a brief amount of inflammation, and then the body can actually heal from that and make those tissues thicker and stronger. When you have more significant tearing or more significant arthritic changes or meniscus damage, we can use PRP. PRP is platelet-rich plasma, so we can take your blood and we have a lab and we can process the blood, and then we can use that for the injections, and that's full of growth factors and other things that can really heal these areas. When you have more significant tearing and more significant degenerative changes, more severe osteoarthritis, then we use stem cells and we use bone marrow stem cells, and that can actually cause a very strong healing response and has been shown to actually heal even some very large tears.
So luckily we can treat MCL tears and potentially heal them with regenerative medicine like stem cells, PRP, or prolotherapy, and this can be done without surgery. So if you want to find out more how to treat your MCL sprain without surgery, click the link below, visit our website, and call our clinic.